My guys, I am sure you have heard that there is Lassa fever. There is something called Lassa fever that is going around now in the country. So, wait. Let's talk about Lassa fever now. The cases of Lassa fever have been suspected and confirmed in some states in Nigeria, Nasarawa, Benue, Plateau. Apart from that, we've even had deaths from Lassa fever, including healthcare workers. So don't think it's only the ordinary people on the street that is affecting. It's affecting healthcare workers too, and some have died from Lassa fever. Lassa fever is a viral hemorrhagic fever. What does that mean? First, that it is caused by a virus. That's why it's viral. Then it comes with fever. That's why it is viral hemorrhagic fever. Hemorrhagic because it causes bleeding. So that means you will see bleeding in people that have been infected with Lassa fever. This Lassa virus is carried by a species of rats that is the multi-mammat rat. That is a rat that has many breasts. So in case you see it, better be wary. How is Lassa fever transmitted? It is transmitted by coming in contact with the feces, the urine, the saliva, or the blood of this rat. It can also be passed from human being to human being. How? By coming in contact with bodily fluids, sweat, blood, feces, urine, sperm. From the time a person is exposed to Lassa fever, it takes about 5 to 21 days, depending on the individual, for the illness to occur or for the illness to show. Now, the problem with Lassa fever, or why people do not suspect it on time, is because it comes like every other sickness. It comes with fever, it comes with weakness, general feeling of unwell. You understand? It comes with symptoms that look like malaria. So that is why anybody might not suspect on time. In very severe cases, the person could start vomiting, could start having diarrhea, start having seizures and bleeding from their orifices like their mouth, their nose, their eyes, and their vagina. Of course, when a person starts losing blood from all the parts of their body, from their orifices, what would the person end up? The person could end up with low blood volume, low blood pressure, and end up in shock. And in the most extreme of cases, as we have seen, these people that are infected might die. Some people might also be asymptomatic, but because 1 in 5 people are going to come down with severe disease when infected by Lassa fever, we are not going to take any chances. Pregnant women are also at risk of very severe disease. So please protect every pregnant woman around you with passion. Now, because we know how Lassa fever is transmitted, it is transmitted how? Through direct contact with bodily fluids of the rat, of a person that is infected. How do we prevent this? First, you're going to make sure you control rats in your home. How do you do that? Keep your environment clean. Clear out every dirt. Anything that will attract rats, remove it from your home. Okay? Store your food in a properly sealed container, because you can also get Lassa fever from eating contaminated food. That is why we tell people, don't go and drink garri anyhow. Garri that has not been closed, that has just been stored in the open, because rats could have had contact with it and you will just drink it. There's no cooking, there's no boiling, and you just take it, you drink it, and a person can contract Lassa fever like this. So store your food in properly sealed containers. Use traps to catch rats, and when you catch, please do not touch them with your hands, because if you come in contact with any of these rats, just touching them alone, because of their sweat, because of saliva, you could contract Lassa fever. So do not touch them with your bare hands. Wash your hand frequently. It's not only COVID that is transmitted by people touching. So please wash your hands frequently so as to avoid, contaminating yourself after touching any surfaces that has been contaminated by persons or by rats that have been infected with Lassa fever. Avoid contact with persons that you suspect or have been confirmed to have Lassa fever. if you see any of the symptoms we have talked about before, I want you to rush. If you have seen, you have been having fever and you've treated malaria, it is not going. You've treated malaria, you are still sick. Please go to the hospital now. Go to the hospital now. Early detection is key to survival, because there they will start giving you supportive treatment that can help your body fight against Lassa fever. There is no vaccine, there is no vaccine. So just go. Early detection is key, and early treatment is also key to survival.